My research paper was about respiratory therapy. What's the role of respiratory therapists? They deliver respiratory care and therapeutic treatment to patients who have breathing and cardiopulmonary disorders. Patients with chronic pulmonary lungs problems such as asthma, bronchitis, and emphysema. Also, to patients who has had attacks and persons who have been in accidents, infants, premature infants, also people who had cerebral fibrosis, lung cancer, and AIDS. What's their responsibility? They includes performing diagnosis tests such as sphincter on breast specimen and blood tests in order to know how's the level for the oxygen level and the carbon dioxide and other gases in the blood. Diagnosis. They are always in charge to interpreting data obtained from this specimen, measure capacity of a patient and lungs to determine if they are impaired to functions, performing stress tests and other studies, the cardiopulmonary system. A study disorder of people with disrupted sleep pattern. Treatments. We have to notice that they always work under physicians monitoring. So they don't work by themselves. They always have to do whatever the physician orders. But they operate machine, various types of high physical equipment to administer oxygen or to assist breathing. And enjoy medical ventilation for treating patients who cannot breathe equally on their own. Monitoring and managing therapy that will help the patient recover functions. Administering medication in aerosol form to help to alleviate breathing problems and help prevent respiratory infections. Monitoring equipment and how patients respond to the therapy. Also include rehabilitation exercise such as low-impact exercise classes to help the patient who suffer from chronic lung problems, maintaining patients' artificial airways once they might be replaced and help patients who can breathe through normal means. Conducting smoking cessation programs for both hospital and other community who want to quit tobacco or other habits. They also conduct limited physician examination. As I said before, a respiratory therapist works under physician supervision. What kind of certificate or degree is required to be a respiratory therapist? And they need an associate degree in order to be a respiratory physician. They can obtain this training in the secondary level of a college, university, vocational, technical institute, or armed forces. It's required to have a license to become a respiratory therapist, but not in Alaska or Hawaii. It's not required. And most employment require the respiratory to have a pulmonary cardiovascular resuscitation CPR certification. Salary of them can be $52,200. The salary for a respiratory therapist were about $52,200 in May 2008. The middle 50% earn between 44,490 and 61,720. And the lowest percent earning about 37,920. And the highest 10% earn about $69,800. Project growth. The project growth of employment in 2008 was 105,900, and the project growth for 2018 is 128,100, which is about 21% of openings. New in this field, 79% of respiratory therapists end up in anesthesiology and pulmonary medicine department in hospital. The other percent work as a physician and other physicians and healthcare practitioners, officer nursing care facilities, or for customer goods rental firms that supply respiratory equipment for home users. The sources that I got the information was for CoreanPlanning.com, Occupation P Risk Therapies, and BLS.gov Respiratory Therapies, and www.aarc.org.